Most people know me as a facial plastic surgeon. What they don't know is the path that brought me here involved military bases, deployment medicine, and lessons I never expected would follow me into the operating room. The truth is, my story did not begin with surgery. It began with watching what responsibility looks like up close. My father was a career Air Force flight surgeon. As a kid, I didn't fully understand what that meant. I just knew that when a pilot trusted him with their health, the stakes were different. These were men and women preparing for missions, sometimes risking their lives just hours later. And I watched my father carry that weight quietly without ever making it about himself. That shaped me more than anything else. It taught me that medicine is not about the doctor. It's about service, discipline, and showing up for people when it matters. I always wanted to be a doctor like my dad. Growing up in an Air Force family, moving from base to base, I saw the sacrifices military families made and the strength they carry with them. I learned early that duty is not a word, it's a lifestyle. And that influenced my desire to be a physician in the Air Force. When I became a military physician myself, I quickly realized something. Airmen would put their mission above their own health without hesitation. I treated pilots who downplayed their symptoms because they did not want to let their teams down. I saw families who held everything together so their loved ones could serve. That created a different level of responsibility, one that forced me to slow down, listen carefully, and give honest, compassionate care even when it wasn't what someone wanted to hear. My father's always told me, be a humble doctor, treat every patient with respect, and involve them in their care. My shift toward facial plastic surgery did not happen overnight. During my third year of medical school, I discovered how fascinating the head and neck anatomy was. Ear, nose, and throat gave me the perfect blend of medicine and surgery. It was the best of both worlds. But the real turning point came later in residency when I was introduced to facial plastic and reconstructive surgery. I realized something important. This specialty requires not just technical skill, but precision, patience, and an understanding of identity. When you operate on the face, you're not just changing tissue. You're working on a part of a person they recognize every morning. There's pressure in that, but there's also purpose. Facial plastics requires meticulous attention to detail, the exact kind of discipline the Air Force had been preparing me all along. My philosophy is simple. Natural results, refined, not replaced, restore what time has changed, and enhance what creates harmony. I don't believe in making someone look like a different person. I believe in helping them look the way they feel inside. When the patient looks in the mirror after surgery, I want them to feel aligned, confident, and proud of what they see. Not done, not altered, just themselves, but refreshed. Now, on a personal note, my family and I love traveling abroad and exploring new places. On weekends, I like to try cooking various recipes I learned from my mom, especially the recipes from Spain. I used to play tennis and golf, but haven't played any for the past 20 plus years. My youngest son is taking tennis and golf lessons, and I'm starting to get the itch to again to play, but I'll have to pick these up again very slowly. These moments away from surgery help me stay grounded and remind me that everyone has a story long before they come to see me as a surgeon. My journey from an Air Force home to military medicine to facial plastic surgery taught me that caring for someone's face is caring for their confidence, their identity, and their story. And every day that responsibility guides me. If you're considering facial plastic surgery or just want to understand your options, I'm here to help you make clear, honest, informed decisions with the same values that guided me from the beginning. If this gave you a better sense of who I am and why I do what I love, I'd love for you to follow along. Feel free to like this video and subscribe to the channel. We'll be sharing educational content, patient stories, and more insights into facial plastic surgery. Thank you for being here, and I look forward to sharing this journey with you.